get a handle on both of them at once, that you understand and respect the client or the patient or the rogi as well as the roga, which is the disease, and what do you do in order for you to actually understand. Just to give you an example, that there is a Vata person having insomnia. Okay? There's a Vata person in their 40s having insomnia. There's a Vata person in their late 70s having an insomnia. There's a Vata person in their 20s and 30s having an insomnia. Okay, there's a very different path of the same disease created in the same body constitution at different phases in their life. And they will all require different interventions for you to address the same disease or a symptom what you're calling about. Imagine a Pitta person in 20s and 40s and 80s having insomnia. Imagine a Kapha person in their 20s, 40s and 80s having insomnia. The disease is the same, more or less. Unable to sleep is the same imbalance or disease you're talking about. But how they create it, how they lead up to that imbalance is very different and very unique. Would you agree to that? And it applies to every disease, you name it. It applies to arthritis, it applies to heart disease, it applies to depression. There are so many different versions of even depression, what we classically know or understand. A Pitta person would become very, very angry and grumpy and irritable even in a clinically depressed condition. He will become homicidal because of that. And a Kapha person will become even more sad and more depressed and more lazy and more heavy and more overweight and all kinds of things, which is creating a psychophysiological response to the diseases.